Healthcare workers and vaccinators here at Pella between Atlantis and Mamre are pleasantly surprised today given the turnout of people that have come out to take their vaccines at these two Vaxi Taxis here behind me. Of course, this initiative, as explained to us early on by the Health MEC here in the Western Cape, Dr. Nomafrench Mbombo, is to make sure that nobody, not even people in the rural areas, people that find it difficult to get to vaccination sites and centres, are left behind. Joining me is Dr. Ibrahim Creel. He's had some interaction with this community of Pella, a former missionary station here between Atlantis and Mamre. Dr. Creel, good morning to you. Very shortly, you were surprised by the number of people that have actually taken up their vaccines today. Explain to us the process, what you had planned for, and by how much that number has been exceeded.
Yeah, thank you very much. So we work together with the community workers and the local health facility to create some awareness in the community and see who would be willing to come and take the vaccine. So yesterday we were informed that around 50 people were definitely interested and about 50 were sitting on the fence, a bit hesitant. So we planned for 100 and we came out hoping that if we reach 100 we'd be quite happy and use it as an opportunity to obviously promote vaccine. But we were quite surprised. By now we've done about 85 already, and you can see behind us there's still quite a few people who are waiting in line and more coming as the word spreads. So yes, we are very happy, but we know that more can be done, and we'll definitely be back. Today showed us that despite numbers initially of registrations being low, we cannot assume that it's because of hesitancy or people not wanting it. It might just be an issue about opportunity to register or access vaccine, and this has definitely opened our eyes. We were always aware that access is an issue, and we came out here to do outreaches before, but this is just proves again that when you create access, people will come.
Now, Doctor, we understand that you've had some interactions with the community, and even when I spoke to one of the community leaders here a short while ago, Reverend Isabel Hans, she was saying there are two factors. One was indeed hesitancy. The other one was the cost of travel. So when you've spoken to people, what sense do you get around the concerns, those who had concerns around the actual vaccine?
I mean, to be honest, the people that I spoke to, the one question they asked me, will we be back? So it tells me that there is an appetite for it, and access is probably one of the issues, and we've been trying and we will continue to endeavour to create access for people. But we can't also ignore the hesitancy and people who are influenced by others, so therefore we are happy to partner with people like the Moravian Church who are positively impacting people to register and get vaccinated. So we encourage those types of partnerships and interactions so that we can get more and more people vaccinated, especially with the fourth wave that's on our doorstep.
And then, Doctor, finally, before I let you go, of course, these Vaxi Taxis, by its very nature, mobile in its nature, can offer both the Pfizer as well as the J&J jabs. Talk to us a bit about the kind of areas that these taxis will be deployed to over the next while. Of course, the Health Minister was telling us that the target for the province still is 85% before the end of December. So I take it that quite a bit of mileage will be added to these vehicles then over the next few weeks.
Oh, definitely. So, I mean, this is a most welcome initiative that has come because, resources are scarce and we will plow as much of what we have into getting people access. So this will just improve that access, especially to the hard to reach places. For example, Pella, it's for people to get to a close health facility. It takes something out of the pocket. It takes a bit of traveling, and so we'd like to eliminate that cost for many people. And it's not just here. We're in Southern and Western where these two Vaxi Taxis will operate in. It's quite a big area, so we're excited to utilize this to get to those hard to reach places. But as the Minister said, in the rural areas they're also endeavouring to use these types of vehicles and other areas in the metro. So we're very excited. We know that December is here already, but we are not done yet. We're still going to plow through December and get as many people vaccinated who would like the vaccine.
Dr. Creel, thank you so much for speaking to me. Of course, Dr. Ibrahim Creel speaking to us here from Pella, an area where initially quite low numbers of registrations seen, but today with the launch of these Vaxi Taxis exceeding the expectations really of those that had planned for around about 100 or so registrations and vaccinations, now seeing that even as we were standing here preparing to cross to you, people were still pulling up in their vehicles, people were coming around to come and register and take their vaccines. Some of the residents that I spoke to a short while ago telling me too that they are at this point happy that they've actually had the opportunity to do so, to protect themselves as well as to protect their loved ones, especially over this festive season.